Hello, my name is Harlan Pickett. I'm the president of Eagle Care Health Solutions and the chairman of the advisory board for FESA, the Federal Employee Service Association. Thank you for joining us today. We appreciate your time. I'm going to share with you some very valuable information about Medicare and how it works with federal employee benefits today. And I hope that you are able to take some of this back to the folks that you work with and are better able to explain how those two things work together. First of all, let's talk a little bit about what Medicare is and how it works. Medicare is a federally funded health insurance plan for individuals 65 and older, individuals with disability or Social Security disability that have been on that program for 24 months or longer, and individuals that have suffered end-stage renal failure, kidney failure. Those folks that fall into those categories, the disability and the end-stage renal failure, we're not really going to cover that too much today because typically that is not what we run into with federal employees. So we're going to stick to 65 and older, talk about how Medicare works during work time, before you retire, if you are over 65, and then of course, how it works once you do retire. First of all, let's talk about the different parts of Medicare. You have Part A, which is hospitalization. Part B, which is everything outside of the hospital. So we're talking about doctor's visits, MRIs, blood work, things such as that will fall into Part B. Part C, which is a Medicare Advantage plan, which pretty much combines the benefits of Part A and Part B, but it's provided by a third-party insurance company, such as United Healthcare, Blue Cross Blue Shield, Aetna, Humana, one of those. And then you also have Part D, which is a standalone prescription drug plan. That is also provided by a third-party insurance company. One of the other things you can have with Part C is a combination of Part A, Part B, and Part D. So you can have Medicare Advantage plans, which are called MAPDs, that include your Part A, Part B, and Part D benefits. So it's kind of an all-encompassed plan. Think of it a lot like the plan that you have right now with the federal employee health benefits, because all of your plans do have medication and also combined with hospitalization and also outpatient or doctor's visits. So it works more like a traditional plan. A lot of folks these days are going that direction. In fact, over 50% of Medicare beneficiaries now are enrolled in Medicare Advantage plans. So they're becoming more and more popular. They also add additional benefits that keep people from having to pay extra for, say, dental and vision, free gym memberships, things like that. So people really like those. As a federal employee, we don't see quite as many folks move over to that because of such awesome benefits that you have as a member of federal employee and of course a postal employee too. So let's talk about how your benefits work with A and B. First of all, whenever you turn 65 and become eligible for Part A, I highly recommend that you go ahead and take advantage of that. The reason is because it doesn't cost you anything. You've been paying for that benefit for your entire career. That line on your pay stub that said Medicare, that's what you were paying for, is Part A. So adding that, sometimes it happens automatically, but if it doesn't, adding that when you turn 65 is kind of a no-brainer. It doesn't cost me anything, and it can provide you outstanding benefits and take care of all those deductibles and copays you may have if you're hospitalized. So I highly recommend that you take advantage of that and sign up when you turn 65. Part B, on the other hand, if you are still working, there is no true benefit to sign up for Part B. While it does cover some of those copays and deductibles that you may have on that side, the cost of Part B in 2022, $170.10, really doesn't make it worth what you would get for it. Unless you've got a lot of things going on and you really need that extra coverage, there's not much reason to get that. Most of your federal plans have low enough deductibles that it would never make up for how much it costs to have Part B while you're still working. The reason for that is because your plan will be, until you retire, your federal plan will stay as the primary and Medicare would be secondary. So it's only going to pick up those things that your plan doesn't cover. Once again, not enough of a benefit in most cases to ever justify the cost of that. So what happens when you retire? Well, when you retire, now you have to make decisions about Part B. No matter how long you work after you become eligible for Part B, because you have a qualified plan through the Federal Employee Health Benefit System, you will never have to worry about signing up for Part B and having a penalty. That's one of the biggest concerns and one of the biggest questions that I get is, well, if I wait, will I have that penalty? The answer is no, you will not. Even if you waited until you were 72 years old, you would not have to worry about that penalty if that's when you retire. Okay, but the key is that retirement date, because upon that retirement date, that's when your special enrollment period to sign up for Part B begins. And you have 8 months from the time that you retire to make a decision on whether you want Part B. If you choose not to, that's fine. But later on down the road, if you decide you wanted it, then you're going to have to pay that 10% penalty for every year that you chose not to. Let's go back and look at that 65-year-old and say at 65, they kept working to 72, no penalty when they sign up at 72. But at 65, if you retired then and decided at 72 that you were going to retire, you would now have a 7-year time period that you chose not to do it. That means you'd be paying 70% more than everybody else for your Part B. In most cases, what that does is it makes it unaffordable for individuals, and they say, well, that's not even an option for me now. So the reason you probably chose 7 years later to get on Part B was because of a medical issue, but now the cost of it's so much higher that it probably is not going to make any difference. You're not going to save any money. It would never make financial sense for you to go down that road if you chose to do that, because you probably stayed with your federal benefits all of that time. And it really comes down to that option is, do you want to just stay with your federal benefits just like you have your entire career? Everything would be the same. You get to choose what level of coverage you want every single year. You get to choose which carrier you want. Open enrollment works exactly the same as it has. Or you get to choose to have Medicare Part A and Part B work with your plan. And you really get to do the same thing. You get to choose a plan that works the best with Medicare. Now you've got a different situation. And a lot of times it comes down to health. Some folks just like to have the security of knowing they have Part B as they get older, but it really comes down to what your health is and maybe what your projected health is. You may want to think about your family history. And if there is, maybe cancer or heart disease in your family history, and therefore maybe you anticipate having some of those issues later on. So getting on Part B whenever you retire is a good option for that. But if you decide to go down that route, there are a couple of plans in particular that I would recommend you look at. One of those is Blue Cross Blue Shield Basic. The Basic and the Standard provide the exact same benefits when paired with Part A and Part B. So if you have Medicare Part A and Part B and the Standard or Basic plan, your benefits are exactly the same. So you'll never have co-pays or deductibles anymore. Everything is taken care of. The difference in the Basic plan is it will reimburse you $800 a year for the cost of Part B. That's a big deal. So if you and a spouse are on it, they will actually reimburse each of you the $800 a year. That can really help offset the cost of that Part B. So it's something I would strongly consider you look at if you're going to use both Part A, Part B, and a federal plan. Another one that does something similar is through the Rural Carriers Association. The rural carriers have a deal with Aetna, and there is a Medicare Advantage plan that you can opt into, and it will actually reduce the cost of your Part B. So in essence, it's a $900 a year value, but it's through the reduction of the cost of Part B. So what happens is they don't take as much out of your Social Security check, or you don't have to pay as much on a quarterly basis if you're paying out of pocket because you're not on Social Security yet. So if you need more information on either one of those, be happy to talk to you about that. You can reach out to me at eaglecare.com, or give me a call. My personal number is 210-417-2700. 2701. That's 210-417-2701. So I hope you understand a little bit more about what your options are when you retire. Now, of course, one of the big questions we're getting right now is, with the Postal Reform Act of 2022, am I going to be required now to take Part B? Well, the answer is not right now. And if you're retiring, you have retired, or you're going to retire anytime before January 1st of 2025, or even if you're 64 years of age or older on January 1st of 2025, you will not be required to get Part A and Part B when you retire. That is part of the Postal Reform Act. Now, here is why someone may want to do that. If you're not doing it now, you may want to do that or even consider it. Is because part of the change of that is going to be within the Federal Employee Health Benefits, is going to be the Postal Service Health Benefits Program. Now, the plans will be very similar to what you have access to now, but they will have certain options within there that are better coordinated with Medicare. That is one of the challenges that we have had across the board with federal employee health benefits, is that they're not really coordinated very well or designed very well to work with Medicare. And you can tell that because the cost is the same, right? I mean, that's the one thing people ask about, is when you retire, the cost is either the same as what you were paying, such as Blue Cross, or you may have a little bit of an increase. But why would that be? If I have Medicare now, we know, and Medicare's primary, we know that the carriers have a lot less exposure. So why would the cost be the same? Well, this addresses that by requiring these carriers to make options that are more Medicare friendly, as in lower rates for people that choose to go with Medicare. So that is one thing to keep in mind, is that you may find options through the Postal Health Benefits Program that starts on January 1 of 2025 than you're finding right now. Now, in anticipation of that, they're offering a one-time only opportunity for individuals to get a special enrollment to jump on Part B. Okay, that's going to start April 1st of 2024. So on April 1st of 2024, 6-month period, anyone who is a retiree, an annuitant from the post office, will have an opportunity without penalty to get on Part B. That's a big deal, because there are people, a number of people that I have talked to over the years, that wish they would have made a different decision. Well, now they'll get a do-over. And so they'll have an opportunity to sign up, and it would be for that January 1, 2025 start date. Now, remember that open enrollment. So the open enrollment that's happening in November of 2024 will be the very first open enrollment for the Postal Health Benefits Program. And so that is, well, don't you know, time's moving fast. So that's going to be here before we know it, right? There is going to be a large push by the post office, by OPM, to really get this information out there. Also, some of the carriers will be really doing a large push to get the information out as we get closer to that time. So be looking for it. You probably have already seen some of the things talking about the changes, at least in a very general way, but know that that is coming. So that's going to be a very important part of it. But there will be a number of people that once we get to that time, to January 1 of 2025, anyone that hits those ages after that, anyone that retires after that, will be required to have Part A and Part B. That's the way that the Reform Act is written. That's the way it's designed. And so that is something to keep in mind. There are some exceptions to that, and that's folks that use military, VA, TRICARE. They're not going to be required to do that. Also, those residing abroad, and anyone that is in the Indian Health Service doesn't have to either. And let me go back and change that. That's VA, not TRICARE. TRICARE already requires their members when they turn 65 to get on Medicare. So that is something that is already required for the folks with TRICARE, is they already must sign up for A and B as soon as they get 65, or actually they lose those benefits. All right, so here is a list of the most frequently asked questions. So I'll kind of go through these guys for you folks so that you kind of get some of the things that we've been asked over and over. I retired in 2017 and elected not to sign up for Medicare. Does this mean I'll now be required to sign up for Medicare? No, as we just talked about, anyone who is 64 or older and retires before January 1st, 2025 will not be required to take Medicare Part A and or Part B. I was told that even if I continue working after I turn 65, that I will have to get Medicare while I'm still employed. Is that true? No, that is a common misconception. The rules will only apply to postal employees who retire after January 1, 2025, with, of course, those few exceptions that I gave you guys. It does not affect you prior to retirement. You will not be required to have Medicare while you are still working. Why is the post office making these changes? This is a long one, folks. Currently, when a postal employee chooses to take Medicare, once they retire, the cost of their plan is the same as it was when they were working. This holds true even though Medicare is now primary. We kind of talked about this, right? This act will allow insurance carriers to offer lower cost plans that work more efficiently with Medicare, and along with other provisions, the changes will save both retirees and the Postal Service an expected $50 billion with a B, over the next 10 years. Obviously, with all of the financial issues we know the post office has had over the years, this is a big deal. This is one of the primary reasons why it was looked at and the change was made. I did not sign up for Medicare when I retired. However, if I wanted to do so to take advantage of one of the new health plans, could I? The answer is possibly. Eligible retirees will be offered a special enrollment period in mid-2024 to sign up for Medicare Part A and or Part B as needed. If a retiree takes advantage of the special enrollment period, they will then be eligible to enroll in one of the new health plans for a January 1, 2025 start date. We covered that, but there it is once again. Who is administrating this new program? It will be OPM. The program will still fall underneath the Federal Employee Health Benefits Program. I did not sign up for Medicare when I retired, and I have no intention of signing up for it in the future. Will this affect me in any way? Yes. Okay. Yes, it will, because if you retired prior to 2025, you will not be required to enroll in Medicare, but you will have to select a health plan from one of the new plans offered by the Postal Service. So even if you never want Medicare, you didn't get it, you never want it, you still will not be able to sign up for the same plans you had previously, because you will have to sign up for a Postal Service health benefit program for that January 1, 2025 start date. Now, they are required to provide a plan. If it has more than 1,500 members, every carrier is required to provide a plan that virtually copies the plan that's available to you now, or available through the Federal Employee Health Benefits Plan. So finding the same option that you have now should not be a big deal. In fact, part of the educational process that they're doing is to give you that information. It's to provide you which plan best matches what you have right now. But you'll also be given the opportunity, once again, to find one that may best match your situation if you have Medicare. So that will be a couple of different things that you have to look at. I'm retiring later this year. Should I go ahead and sign up for Medicare Part A and Part B, since I'll be required to do so in 2025? Well, since you're retiring before January 1, 2025, you will not be required to sign up for Medicare. Signing up for Medicare now may be still be in your best interest, depending on your health and finances. We talked about this earlier, right? However, if you should not sign up now, you may have an opportunity to enroll during the special enrollment period in mid-2024. I am retired, and due to health concerns, I signed up for Medicare late. Will the new rules allow for my penalty payments to be waived in the future? No, a resounding no on that. Only those individuals who take advantage of the 2024 Medicare special enrollment period will be subject to the penalty payments being waived. So if you're already paying a penalty, that will not go away just because of this new rule. That doesn't affect anything. It only affects folks that are signing up in that special enrollment period. I'm about 5 years from retirement. I may possibly choose to live abroad. At that time, will I be required to have Medicare? Now, as we mentioned earlier, you will be excluded from that. So no, the Postal Reform Act makes a very specific exception for those who reside abroad. That's the most common questions that we have up to this point. I'm sure some of you may have some questions, and we would love for you to send them over to us. You can reach me really at two different places. You can reach me over at FEHB at hpickett@gofesa.com, or you can reach me at EagleCare at hpickett@eaglecarehealth.com. A couple of things to keep in mind is if you know someone who is retiring early and they are leaving service and they do not know which way to turn for their health care because they are losing their federal benefits that way, we can help them over at EagleCare. That is one of the reasons we built these solutions that we did, is to help both non-career, which we can also help those folks, non-career federal employees and federal employees who do not qualify for one reason or another for their federal benefits once they leave service. As many of you know, if someone doesn't have 5 continuous years of being on federal employee health benefits before they leave service, they cannot take that with them into retirement. So we have a number of folks that we have helped find solutions if they fell into that category. FEHB also provides excellent resources to help you understand better what your retirement will look like in advance of that retirement, both on the Social Security, where you can get a free Social Security analysis to find out exactly what you'll be making there. Find out what your FERS annuity, or for some of you that may be sticking around with civil service, show you what that civil service annuity is going to look like, and then also help you understand what your options are with your TSP. That can be a very confusing part of things too, and the folks over at FEHB can help you with absolutely free benefits analysis, go through all of those parts. I hope today has been informative and helpful for you. Remember, we're here for you. You can reach us at eaglecare.com or gofesa.com. Thanks. Y'all have a blessed day.